Welcome back to the chat. Did you know that according to the National Eating Disorders Association, 20 million women and 10 million men suffer from a clinically significant eating disorder at some time in their lives? One of those disorders is anorexia, which has the highest mortality rate of any mental illness. So, what if there were a more effective way to help diagnose, treat, maybe even prevent anorexia? Joining us now to discuss some new research that could make a significant difference, we welcome our medical contributor, Dr. Ali Kasraeian. Thank you so much for being here.
Thank you for having me.
So, anorexia, such a serious topic to talk about, and as we said, its mortality rate is unreal with it. And
Wonderful topic to follow a comedian.
I know, right?
Yeah.
Well done, Bonnie.
Just like he said, it could, go from one end to another.
Yeah.
But the new research involves stem cells in regards to anorexia.
Well, I mean, the interesting thing is they use kind of a stem cell to come up with a model for researching anorexia. So before, it's thought of as a mental disorder. It's a decision. No one really knows what's going on. So with that, a lot of judgment comes in. And anorexia, to think about it, is basically a disorder where people are very, very consumed and obsessed with their body image and controlling that body image and their weight. And so people with anorexia are very thin, and they try to control their body image. And the problem with that is they assign thinness and associate that with self-worth.
Yeah, you think of it as a psychological disorder.
Absolutely.
Is there a genetic component to anorexia?
So what this group did, and it's an international group led by scientists at the University of California at San Diego, and what they did is they actually took 4 women with anorexia and compared them with 4 healthy women, and they took basically stem cells, and they manipulated them to become neurons, brain cells, and they analyzed them. They analyzed the whole DNA, the pathways, the neurotransmitter along that pathway, and they found that there was one gene, the tachykinin receptor 1, and they found that there was a defect there. And so why this is kind of interesting is that it allows them to now study this as a potential genetic association with this, and this opens the door for looking at this more of a genetic predisposition to a disease which was previously thought to only be a psychiatric, psychological problem where someone just began to become obsessed with their body.
It's been around for such a long time that people have been suffering from this. Yet it seems to me, and I could be wrong, maybe correct me, that there just hasn't been that much breakthrough when it comes to treating anorexia. Not really.
Well, it's a very difficult disease to treat.
Yeah.
And it's very challenging because if you look at how difficult, admitting that this is a problem becomes a very challenging thing. As we find, as we talk about often, the acceptance of mental illness is only just beginning to come to fruition. If you look at one of the most wonderful things that has happened over the past several years is that we're finally beginning to talk openly about mental illness, and hopefully that changes our acceptance of mental illness so that people who are suffering from mental illness feel comfortable to talk about it, just like whenever we feel ill of any other capacity. If we have chest pain, we don't sit around and wonder whether we should go to the doctor because we have chest pain. We probably sit around because we're too stubborn to go to the doctor.
Right.
It's not the disease that keeps us from going and having that conversation.
Yeah.
So hopefully this begins to change the framework of not just having the conversation about mental illness, but now it gives scientists a framework of looking at possibly there's a genetic contribution to it, so it changes the framework of the discussion from a scientific platform. So that's really interesting.
It is interesting. And on the topic of stem cells, there has been a negative turnout for 3 women. This is crazy. They were undergoing stem cell treatments, and the 3 suffered severe permanent eye damage after stem cells were injected into their eyes. Now, Dr. Ali, according to the New England Journal of Medicine, this was the result of an unproven treatment. Now, for one thing, I don't know much about this, okay? I'm not a doctor, but it doesn't sound like a really good thing, injecting stem cells into eyes.
That gives me the creeps.
Yeah, I mean,
yeah.
So if you kind of look at this in a number of different ways. One, the reason you kind of jump back on your heels is because we don't know much about stem cells now. So initially you kind of think, is this hype or not? And so if this was another kind of therapy, we may not be necessarily thinking about this in a different way. One of the things to kind of think about this, just as a physician, my first inclination in reading this article is most of us that treat organs that have two of them always take a little bit of a step back, and we tend to treat one organ at a time. So that's one of the first things when you have two organs. Be very mindful of talking to your physician about possibly treating them in sequence. So that's one of the things. Actually, the physicians who discussed this in commentary talked about that being an issue. So if you are someone, especially with your eyes, if you're going and discussing getting treatment, have a discussion with your ophthalmologist about possibly sequencing it and doing them separately and not doing both, because God forbid, and there are always complications with any procedure, make sure that you talk to them about doing it not both at the same time. With this, if you look at stem cell research, there are very few stem cell therapies that have actually been researched and studied that have been both safe and efficacious.
What are those?
Blood diseases.
Okay.
So blood and immune disease. We spoke about this the other week, where people that have blood diseases, you can go and take their bone marrow out. We've had successes with stem cell transplantation, both from other people and also now the amazing world where you can take people's own stem cell out, correct genetic defects, put them back in. We had an amazing thing that happened in France last week where they took the person's stem cell out, made the correction, put them back in, and 2 years out, they're doing great with sickle cell disease. So that's one that we've had great successes. We're learning a lot, amazing research going on. I think the world of stem cell research opens the door for amazing things in the future, but there are very few things that we have had amazing successes and home runs that have been hit that we can say without refute that is both safe and efficacious, that we can say, let's go inject stem cells in your eyes and it's going to be great. The other thing, when you look at clinical trials, if people approach you with clinical trials for things, they should not be charging you $5,000 to
They charge $5,000 for these women to be in this trial.
So be mindful, if things are undergoing a trial, if they're in clinical, there really should not be a charge associated with that.
Should be free.
If they're actual, if there are actual trials that are going on from that nature, so explore that. Doesn't mean that you can't pay for therapies, but be mindful of that's going. Doesn't mean that you can't collect research and follow things that are paid for, but be mindful of that. So when you look at that research things in terms of stem cells, not everything that is being done on the guise of stem cell therapy is necessarily the cutting edge of taking genes and splicing things and doing the things that sometimes are being done. Amazing research is being done. Stem cells are going to break through and do a lot of amazing things for us in the world of medicine and us as people. However, be very mindful that not everything that is going on right now, especially things that are being heralded and blown up with hype for lots of money, may not necessarily always be safe and have been vetted. There's very few things that have been studied in large volume of patients that are both safe and efficacious.
Okay, good
Such
to
great
know.
information.
Very good things to keep in mind.
Always, yeah.
All right, well, thank you so much for joining us, Dr. Kasraeian. We appreciate it. This medical contribution was furnished by Kasraeian Urology. You can hear more from Dr. Kasraeian on his weekend radio show, The Conversation, Saturdays on WOKV from 5 to 6.